Hi everyone, I'm Dr. Sourabh Sharma. So let us see this NEET Predictor questions. Hi Rahul, Arjun, Dishant, Yasit. Alright, so see, I've given 15 questions. Sir, in the app it was showing 20 questions. Okay, I have given 15 questions actually, but 5 extra I have given from INI Predictor series. So if you got those 5 questions wrong, that means you have not done the INI predictor. Solving INI PYQ is also important for NEET ones. That is the point I wanted to make. Questions from INI predictor, if you're getting wrong, then that is not good. Now let us see the first 15 questions which actually I gave for the NEET predictor. Okay. Alright. Hi everyone. Good afternoon. I'm Mahek, Sapna, Aman, Ruchika, SK. Let us see the first question. The first question is cataract surgery complication. Now, cataract surgery and its complication per se is an important question of PG exam. I've given a picture. This is the picture which is showing hypopion. Nothing else you can appreciate. You can see only hypopion in this picture. But in the text, that on the first post-op day, after complicated cataract surgery, means something complication is done during cataract surgery, the doctor noticed the pic which is showing only this yellow thing is hypopion, visual acuity was less and there was pain. The intraocular pressure was high and there were cells in the anterior chamber. Whenever there is inflammation, there can be cells. Cells does not mean that there is uveitis. It means it is not per se idiopathic uveitis, but there can be some other causes. Now, ultrasound B scan is done for posterior segment evaluation. When the doctor cannot see the vitreous and retina, then ultrasound B scan is indicated. Means he was not able to see the vitreous and retina. That's why he did ultrasound B scan. And vitreous exudates were there. Which of the following should be done? First, what is the diagnosis? One diagnosis comes toxic anterior segment syndrome, TASS, which cannot be the answer because vitreous is involved. As the name suggests, sometimes only by name, toxic anterior segment means there is inflammation only in the anterior segment, means till the lens. Vitreous is not involved. It is due to inflammation to IOL material. So TAS cannot be the answer. Endophthalmitis or pan-ophthalmitis is the next differential. What is the keyword between endophthalmitis and pan-ophthalmitis? Endophthalmitis and pan-ophthalmitis. Endophthalmitis means infection, inflammation of inner layers of eyeball except the outer fibrous. Outer fibrous means cornea sclera. So if cornea sclera is also involved, then it is a pan-ophthalmitis. Here in this picture, there is nothing related to, nothing written for cornea, nothing for sclera. So answer is, the diagnosis is, it is acute pan-ophthalmitis. Why acute? Why acute endophthalmitis? Why acute? Why not chronic? Because chronic endophthalmitis by definition is after 1 month. Most common organism Propionibacterium acne. For acute endophthalmitis, which is the normal commensal of the conjunctiva, PYQ question of FMGE, staph epidermidis. That is the most common cause of acute endophthalmitis. Within 1 day, staph aureus can cause. Okay, so staph epidermidis is the overall most common cause. That is the normal commensal. That's why before cataract surgery, povidone iodine wash is required. So that is the diagnosis. But what is the management? The management is you have to give antibiotics. Intravenous antibiotic has no role. Systemic antibiotic has no role in endophthalmitis. Means you can give anti-glaucoma, you can give steroids, but antibiotic has to be given. But why not topical? Because that is not in the option. So intravitreal. Why? Because topical works only up till the lens. Topical works only in anterior segment. You should know that. Topical drops. So intravitreal, tap and antibiotics is the answer. So what is tap? You will take out a part of vitreous, then only you will send sample. Who will tell it is a staph aureus, epidermidis, propionibacterium? Micro people. So you have to give sample. Sample is intravitreal tap. And then you put antibiotics. That is the answer of this question. C is the answer of this question. Good afternoon everyone who joined now. That is the first question. I don't think so any doubt. Yes. So what is endophthalmitis? Is a type of uveitis. Endophthalmitis is non-granulomatous pan-uveitis. If corneal sclera is involved, then answer is acute pan-ophthalmitis. That is also non-granulomatous pan-uveitis. But purulent. Endophthalmitis, pan-ophthalmitis is purulent. Purulent means organisms are causing uveitis. Non-granulomatous pan-uveitis. If corneal sclera involved, it is pan-ophthalmitis. For pan-ophthalmitis, answer will be intravenous or systemic antibiotics. Alright, and if that is not able to solve, then evisceration is done. If endophthalmitis answer, intravitreal type N antibiotic. If that is not able to solve, vitrectomy is done. Pars plana vitrectomy. All the intravitreal injections are through pars plana route. So pars plana vitrectomy is done if for non-resolving endophthalmitis. Why pars plana? Because that is relatively avascular. The first page of our workbook or the ophthalm is pars plana is relatively avascular as compared to pars plicatum. So all the intravitreal injections, all the probe inside the vitreous is through pars plana route because it is relatively avascular part of ciliary body. That is the first question of predictor series. So please, one cataract surgery or its complication question is expected, was asked in INICT as well this time. It is expected to be asked in NEET exam also this time. Any cataract surgery complication, like most common complication, PCO, posterior capsular opacification was asked last time in NEET exam 2024. After cataract, that is posterior capsular opacification. Endophthalmitis can be asked. So cataract surgery and its complication is an important topic of any PG exam. Now thyroid eye disease was asked last time as a theoretical question with a picture. A picture was bulging eyes was shown. I have not given a picture, I have given a text. Sometimes one word can change your life. One word can change your answer, and one answer can change, one correct question can change your rank and your life also. Let us see one by one. Thyroid eye disease. These words, actually the last time they asked a question directly, if you see a book known as Parsons, each and every word of the last time NEET exam were for Parsons. So this is also verbatim. Verbatim means word by word from Parsons. Let us see. Thyroid eye disease is a HLA mediated autoimmune reaction. There is inflammation, glycosaminoglycan deposition in the orbit tissues, which can cause bulging of the eyes, proptosis. That is known as exophthalmos. So mild exophthalmos may be associated with thyrotoxicosis, and an extreme exophthalmos can be seen in any state of thyroid activity. That was a last year statement also. That is why, this true statement, that is why thyroxine levels can be anything in thyroid eye disease. Hypo, normal, hyperthyroidism. That is why treatment is not based on thyroid hormone status. Antithyroid drugs has no value. It is inflammatory condition, so systemic steroid is the treatment, and that is this one. That is also true statement. The main treatment modality of thyroid eye disease for proptosis is systemic steroids. It is an immune reaction, HL mediated immune reaction. Now, this was the last time Werner classification, no specs was given last time, and that is nothing but Werner classification. It reflects the severity of thyroid eye disease. That is true. Sir, why is B wrong then? B is the answer. One word, only one word. There is retraction of eyelid, that is Darlimpes sign. But it is not due to levator muscle. Levator muscle is supplied by third nerve. It is due to Muller muscle. That is the answer. Muller muscle is sympathetic activity, and thyroid has sympathetic activity increase. So increase in sympathetic activity can cause elevation of the eyelid. That is lid retraction. That is the answer of this question. So one word, everything is true except this levator word. And that is one word can change your answer, life. Also very important. Good, Nibetita. Alright. So that is the second question. Third. Now this is the anatomy question. That in the orbit, in the apex of the orbit, if you see in the apex of the orbit, this is a superior orbital fissure. This is the optic canal. And what is this? Annulus of Zen. The four recti muscle are originating from the annulus of Zen. Superior rectus, medial rectus, lateral rectus, and inferior rectus. So the question is, which of the following pass through the middle portion of SOF, and that can be remembered as, now this is a fact, anatomy question, but can be related to your clinical orbit as well. So NOOA, you remember, N is nasociliary nerve, not in the option. O is oculomotor, superior inferior division of oculomotor, and A is the abducens nerve, and that is written over here. Both responsible for retraction. Why? Muller muscle is responsible for lid retraction, Aditya. LPS fibrosis occurs in the late stage. Yes. But Muller sympathetic activity increase, that causes lid retraction. I told you word by word, verbatim word from Parsons. Okay. The other are from LFT from the upper portion, LFT from the upper portion with superophthalmic vein and inferior-ophthalmic vein from the lower portion. Alright, and this optic canal, this is optic canal, structures passing through optic canal are optic nerve and ophthalmic artery. Along with that, some sympathetic fibers also come along with ophthalmic artery. So that's the fact. This is the anatomy question, and you should know some orbital syndromes. If there is an apex of the orbit, there is a pushing of the orbit, proptosis, SOF syndrome, orbit apex syndrome, and if it goes behind, that is cavernous sinus syndrome. Multiple cranial nerve palsies can be there. So that also you should know. I can't discuss those. I have to discuss 15 questions first. So that's the third question. Now the fourth question. A secondary open angle glaucoma developed if the lens has been damaged or if lens proteins from a hypermature senile cataract escape into the aqueous is seen in. Some keywords are there. Keyword is open angle glaucoma secondary due to lens. Lens means phaco. All the four options as phaco means lens. Lens protein. So if you know the other name of lens protein glaucoma, you could have answered the question. And hypermature senile cataract. There is a hypermature senile cataract. If this is the lens, this is the nucleus, and this is the cortex. In hypermature senile cataract, in one cataract, the nucleus sinks due to dissolvement of cortex. That is known as Morgagnian hypermature cataract. And what happens in Morgagnian hypermature? See, already in hypermature, the lens size is very small. Immature, mature, hypermature, the lens shrinks. If the lens is shrinking, already the antechamber is very deep. There is deep antechamber, and nucleus is sinking down. Lens protein is coming out of the capsule, and it blocks the trabecular meshwork. It blocks the trabecular meshwork means secondary open angle glaucoma. That is what? Phacolytic glaucoma. Because lens is lytic, it is also known as lens protein glaucoma. It is a secondary open angle glaucoma. You have to do cataract surgery under IOP control. That is the answer of this question, also known as phacolytic or lens protein glaucoma. Deep antechamber is there. In contrast, phacomorphic, one question from INI Predictor, which I'll tell you, is phacomorphic glaucoma. When the lens becomes intumescent, it pushes the iris forward, causing shallow AC secondary angle closure. That is intumescent phacomorphic glaucoma. In English, phacotopic glaucoma, due to ectopia lentis. Ectopia lentis means due to subluxation, dislocation, ectopia lentis is there. Phacotoxic is very rare due to toxic reaction of the lens particle, which can cause inflammatory reaction, uveitis, in the antechamber. That is also open angle glaucoma, phacotoxic, but not very important. Phacomorphic versus phacolytic is a very important question of PG exam. This was once asked. A 80-year-old patient comes to you with deep antechamber. 80-year-old means senile cataract with deep antechamber, very high intraocular pressure, with some cells and flare in the antechamber. One of the options was phacolytic glaucoma, that is lens protein glaucoma. Alright, so 4 questions till now. Now, which you scared of, I don't know why. 6 nerve palsy, LR6, lateral rectus causes 6 nerve palsy. So if there is a 6 nerve palsy, for example, there is a right 6 nerve palsy, means right lateral rectus palsy. So what will happen in primary gaze? The left eye is in the center, right lateral rectus is not working. So because of Sherrington law, the right eye will go inside, means medial rectus will work more, means it will be esotropia. First question is, there is esotropia in primary gaze. That is true statement. I have asked which is false. So esotropia is there in 6 nerve palsy, lateral rectus palsy. Now it will have diplopia because both eyes are not straight. Binocular diplopia. But crossed or uncrossed? We remember that now. Exo has cross and exo has word has X, that is cross. So exo has cross diplopia, ESO has uncrossed diplopia. So that is the wrong statement and that is the answer. That is how you solve this. Only by two options you cannot solve this question. That ESO is there in 6-nerve palsy and ESO has uncrossed diplopia. Even if you don't know this maximum diplopia, phase turn doesn't matter. You should know that exo has X and X has cross diplopia. But let us see. In a paralytic squint, the maximum diplopia is on looking the paralyzed side. Means in right lateral rectus palsy, if the patient looks right, there is maximum diplopia. Why? You see over here. You can draw a chitra over here. What will happen if the patient sees right? Right eye will remain like this because of total palsy, but left eye come here. There is maximum diplopia. Why? Because you are, see, if the patient looks on the left, in the same question, if the patient looks levo version, this eye is already in the left side and left eye will also go there. Means both eyes are aligned. There is no diplopia on looking left, maximum diplopia looking right in the direction of paralyzed muscle. And phase turn is also on that side. This is how I tell in the class to identify from this line diagram. This is right, this is left, lateral rectus come over here. So right LR palsy is on the right side, working on the right side. So maximum diplopia on right side, phase turn is also on the right side. So phase turn on the right side means what? Vestibulo-ocular reflex, 3, 6, 8 nerves. Eyeball goes on the left. And see, when the eyeball goes on the left, there is no diplopia. That's why the patient comes with right phase turn on the paralyzed side. Abhishek is asking, is this yes, it is Sherrington law. That right LR is not working, right MR is overacting, antagonist is overacting. So tell me one statement. In squint, the direction of the squint depends on which law? Direction of squint means ESO, exo, hypo, depends on Sherrington law. If LR is palsy, eye is going inside, means Sherrington law is working. And that is only by two statements, answer was solvable. This picture was asked in last year just to identify. You should know this, a very important dystrophy of rods and cones. Young patient, night blindness early feature. That is some bony spicules. This is retinitis pigmentosa, which is a dystrophy of rods more than cones, photoreceptors. Young age. There is a triad. In this picture I have shown you what? I have shown you a fundus picture. The left fundus picture having waxy disc pallor, bony spicules, arteriolar attenuation. That's a clinical triad of retinitis pigmentosa. There is no treatment of retinitis pigmentosa. So why will you do pan-retinal photocoagulation? One student, I told them yesterday in my TNT to tell how many questions I've got correct. So one said 19 out of 20. One question he got wrong. Why? Sir, pan-retinal photocoagulation is done in diabetic retinopathy, venous occlusion when the entire retina is ischemic. Why will you do? Because I know why I give this option, because you will think in your mind, sir, pan-retinal photocoagulation also looks like this. It looks like that, but that is not the treatment of pigmentosa. Na? In pigmentosa, there is no treatment. You give vitamin A, docoxahexanoic acid just to prevent the progression. There is no reason of this photocoagulation here. And there is a triad. In my telegram course I gave you the three triad of the associations of pigmentosa. Any dystrophy, any degeneration of the eye can lead to posterior subcapsular cataract, that is complicated cataract. So there is a triad, means PSC is associated, keratoconus is associated, and open angle glaucoma is associated with retinitis pigmentosa. There is no reason for this. ये तो बुरी तरह रटना है ना? The three triad of associations: open angle glaucoma, keratoconus, and posterior subcapsular cataract. Yes, Nivedita. Got this wrong, Anshita. Why you got this wrong? Anshita, तुम्हारी बात ही कर रहा था मैं actually. You got 19 out of 20. I know. Why you got this wrong? Why you will write pan-retinal photocoagulation as the treatment here? This is not right. Okay. इतनी गलती मत करो ऐसे. Very good. मुस्कान हंस रही है, नाम मुस्कान है, हंस भी रही है. Chalo, answer is C. And there is a test known as photo stress test. Photo stress test value is more in this because rods are not working. Photo regeneration time is more. ERG, EOG. ERG is decreased because that is because of rods and cones. A wave decrease first, B wave decrease later. Yes, Anshita, I knew that. That's why I give this option. All right, next. Next is what are the keywords? Keyword is follicle, other is near the limbus, and other is infectious disease. Infectious disease. Infectious disease gave you the answer here. Horner-Tranter dots is in vernal keratoconjunctivitis. Is it infection? It is allergic response. And allergic response has more papilla. So that is not the answer. Herbert pits. And Herbert pits seen in trachoma, okay, fine. Flicton also is at the limbus, but Flicton cannot be the answer because that is also a type 4 allergic response. That is philic tenular conjunctivitis. That is also not a infection. It is a type 4 response to staph and TB antigen. Topical steroids are given. So that is not the answer because the question says infection. Pinguncula is a fatty deposition, degeneration of the conjunctiva. Yellow color fatty deposition. That is not infection. Only infection of the question is trachoma. Trachoma is Herbert Pitts was asked to identify. This is a theoretical line from Parsons. That what is Herbert Pitts is the follicle-like depression due to follicles. Follicles goes in favor of infection. Papilla conjunctiva goes in favor of allergy. So follicle was a keyword. Infection is a keyword. And follicle depressions on the limbus is Herbert Pitts. That is the sequel of the follicles. And that is the answer. Trachoma is eliminated. PSM question. Huh? PSM people are taking many questions nowadays. Like Bitot spot. And someone told that Bitot spot was discussed by biochemistry also. Skin also. Kaise? How is it possible? Bitot spot. तो हमारा क्वेश्चन है यार. Herbert Pitts भी हमारा क्वेश्चन है. कहीं वो Herbert Pitts ना ले लें अब. तो Herbert Pitts is in trachoma. Trachoma is eliminated, but questions on trachoma is not eliminated. Last in image, now a text. ऋतुराज क्या बोल रहे हैं? ऋतुराज धेपे जी सही आया ये वाला. हाँ सही हुआ तो सही होना चाहिए तो ठीक है. चलो. Now, open angle glaucoma, very big question. Line by line, we have to see that. 8th question. The inheritance is thought to be multifactorial, polygenic, many genes contributing, specific to long arm of chromosome 1. Doesn't matter if you don't know. Sometimes in the options you don't know. Let us see the other options. Just leave it. Second, rise in intraocular pressure in POAG is related to primary open angle glaucoma due to resistance of the flow of aqueous at trabecular meshwork, especially juxtacanalucular. You should know this, that this is the true statement because that is the main reason. There is resistance mostly at juxtacanalucular, and juxtacanalucular word was a PYQ. That where is the maximum resistance of trabecular meshwork, juxtacanalucular. So this option you should know. And which disease in ophthalmology is known as silent thief of sight? That is open angle glaucoma. That's why it is generally asymptomatic in the early stage. This is also, you should know this. First, I agree, okay, if you don't know, doesn't matter. But you should know that if there is a damage to optic nerve, glaucoma is optic neuropathy, optic nerve fibers are damaged. Once everywhere in the body fibers are damaged, can you reverse it? Of course, medical management is given, but can you reverse it? You can't reverse whatever damage has been done. So you should know that this is a false statement, and that is the answer. Even if you don't know the first option has to be true because D is the answer. First option is true. Again, line from Parsons. Even if you don't know, doesn't matter. MCQ is a game of 3. You should know the other 3 options. Second and third are expected. Silent killer of sight, silent thief of sight, open angle glaucoma, trabecular meshwork resistance, open angle glaucoma, and it is not reversible. That's why glaucoma is the most common cause of irreversible blindness. Good, Sapna. All right. Then this is a image was asked in INS, not this, in INSCT the entire retina animation picture was asked. I have given just a part of that. And a similar question I gave in INSCT Predictor, not exactly. This is a photoreceptor cell which is like a this. What is this softy? Softy means a cone. So this is the cone photoreceptor, where this is the nucleus, B is the nucleus, and the nucleus of the photoreceptors are in the outer nuclear layer. And this is a segment, inner segment, outer segment. That is the question. Which is the inner, which is the outer? Outer segment contains this membrane discs. So INICT question was there. All of the following are present in the inner segment of the photoreceptor except. Answer was membrane disc. You see these discs, lines are discs. So this is the outer segment which is towards the choroid. Inner word is towards the vitreous. So this is the outer segment, contains the membrane disc, means rhodopsin, iodopsin. And C is the inner segment. INI question. 3 things in inner segment are mitochondria, endoplasmic reticulum, Golgi apparatus. Even if you don't know, you should know one thing, na? Membrane discs, लिखा है यहाँ पे disc और बना हुआ है discs. That is seen in outer segment. What is A? Who can tell me what is this A? A is a plexiform, synapse. So phototransduction occurs in rods and cones. Light comes, nerve impulse. It goes to bipolar cells, inner nuclear layer, via outer plexiform layer. So A is your outer plexiform layer. That is a synapse between the rods and cones and the bipolar. So this is the cone cell. Cone by, it's like a cone, na? तभी तो cone है ये. And that's the answer over here, which is the outer segment. D is the answer over. बताना किसने गलत करा ये? जिसने गलत करा, who is not studying INICT questions and he is not seeing the INI predictor questions as well. Good. A.S. All right. 10th. Now 10th question is also remember last time NEET exam you should have solved the PYQ. There was a worth 4 test question. This is Maddox rod question. The patient was diagnosed with again lateral rectus palsy. Lateral rectus palsy I just told you is esotropia, and esotropia has which diplopia? Uncrossed diplopia. 2 options you could have ruled out over here. Which one? If Maddox rod is kept in front of right eye here, rod means cylinders, and axis horizontal. So patient will see a vertical line, na? Because cylinders work in opposite axis. So D option is ruled out because patient is seeing a vertical line. So D is ruled out. You should rule out D. And patient is having squint. So A is ruled out because A is seen in normal. That the right eye will see a vertical line, and the torch, you have to show torch. It's a binocular test. Torch will be in the center. The only is between B and C. So when you are ruling out 2 options, you should definitely mark that answer. Now this, the interpretation of this Maddox rod, worth 4 test, visual field is its patient's view. This is just to show that in which eye the Maddox rod is kept. The interpretation is patient view, means you are the patient. You have uncrossed diplopia, no? ESO has uncrossed. And you are wearing Maddox rod on the right side. So line should be also on the right side. Patient's view like this. So line on the right side, torchlight on the left. Which is the answer? B is the answer of this question. In B, the line is on the right side because it is uncrossed diplopia. C is a cross diplopia, that is exo. So that was the multiple level question. First you should know lateral rectus palsy has ESO. Then you should know ESO has uncrossed diplopia. Then you should know this is Maddox rod. You should know Maddox rod is always working in opposite because rod is cylinders. So D is ruled out. Is ESO, so A is ruled out. And uncrossed diplopia has to be in patient's view. So B should be the answer. Who can tell me if patient has left eye suppression, what he will see? Left eye suppression means left is not working, so the patient will see only a vertical line. And if right eye suppression, patient will see the torchlight. Okay, that's the binocular test. So that's the 10 questions till now. Here comes the 11th. This is Anshita, pan-retinal photocoagulation. This is the procedure. It is written procedure. It is not pigmentosa. It is procedure. This is pan pan-retinal photocoagulation. Pan means the entire retina is photocoagulated, means destroying. Center is spared. You see over here, na? Center is spared. It is macula spared because you can't destroy the macula. If the macula is spared, that's why the side effect is tunnel vision. That is also known as ring scotoma. Only this information was needed. That side effect of pan-retinal photocoagulation is ring scotoma. So how can it cause central scotoma? Central vision is spared. That is the wrong. That is the answer over here. Even if you don't know A, B, C, that's the answer, no? Central is spared. It is tunnel vision. What are the differentials of tunnel vision? Quickly revise with me. Tunnel vision differential. Pan-retinal photocoagulation. Retinitis pigmentosa. One more. Gyrate dystrophy. Biochemistry question. Ornithine aminotransferase enzyme deficiency. Advanced glaucoma. And 2 drugs. Anti-malarial. Quinine. Anti-epileptic. Vigabatrin. Let us see one by one. Why you do pan-retinal photocoagulation? So you have to destroy the hypoxic area, make them anoxic so that VEGF is not produced, because VEGF is produced by hypoxic. It is done in diabetes in advanced cases from proliferative stage of diabetic retinopathy where new vessels are there. And you use this argon and Nd:YAG 532. That is photocoagulative laser. This is second option is also true for retina hole. You destroy. If there is a retina hole, retina tear, most common horseshoe shape, you have to destroy the retina tissue around the retina tear so that fluid does not come. So retina tear also are lasered by photocoagulative laser. Laser iridotomy, laser capsulotomy for PCO is done by Nd:YAG 1064. That is photodisruptive laser. And one more, a very difficult question. I don't know you will be able to solve or not. What are you doing over here? Which layer of the retina you are putting burns to? All these are burns. 2500 to 3500 burns in multiple sittings are there. Which layer you are aiming the burns? Difficult question, but I don't know. I have not told this to anyone. Sometime in class I tell you. The burns are to which layer of the retina? I'll give you option. Ganglionic, bipolar, rods and cones, retinal pigment epithelium. The burns of this photocoagulation is to which layer? Ganglionic, bipolar, rods and cones, retinal pigment epithelium. No, till now wrong answer. None has given the correct answer till now. Shabdeep, AS, Anchita, हर्ष मैंने तो OPL ऑप्शन ही नहीं दिया. गैंग्लियोनिक गलत है. गैंग्लियोनिक को डिस्ट्रॉय करोगे तो नर्व फाइबर डिस्ट्रॉय हो जाएगा. ना yes, Dr. DC has given and Harsh Maratha has given the correct answer. Also शायद RPE. You are giving burns to retinal pigment epithelium. That is the answer. Retinal pigment epithelium burns. सोच लो, क्या पता ये नीट एग्जाम में आ जाए. But एक क्वेश्चन तो आ सकता है. This question can come. A proptosis in a child. A child present with proptosis in one eye without pain. So cellulitis is ruled out because cellulitis has pain. On examination, mass was hard. Okay. In toto excision was done in view of cosmesis. Post-op histopathology, keratinized epithelium, adduction structures means germ cell tumor. Which is the germ cell tumor? Dermoid, not limbal dermoid. Limbal dermoid will not cause proptosis. Any dermoid is a germ cell tumor, but orbit dermoid can cause proptosis. It's the most common benign tumor of the orbit in child. That's why in toto excision is given. In toto excision is done for orbital dermoid. It is choristoma, normal tissue in abnormal place. Limbal dermoid was picture asked in last NEET exam. 2 times it was asked. Limbal dermoid. Limbal dermoid with hair follicles at the limbus. That will not cause proptosis. Proptosis is the orbital dermoid. Every dermoid is benign tissue. In toto excision is done. If I have given a question, tell me. A 7-year-old boy comes with painful proptosis. Histopathology, eyeball was taken out and there was rosettes with desmin positivity. Then answer is rhabdomyosarcoma. Myo means desmin. Retinoblastoma can have any presentation in ophthalmology. Leukocoria is the most common. Squint is the second most common. Rosettes keyword. Calcification keyword. synaptophysin keyword, chromogagging keyword for retinoblastoma. Last year NEET exam question. Calcification, chromogagging, synaptophysin, rosettes, leukocoria in a child. Treatment depends on the stage of retinoblastoma. It is the most common malignant tumor in child. Most common malignant tumor in child in eyeball is retinoblastoma. Most common malignant tumor in child in orbit is rhabdomyosarcoma. Rhabdomyosarcoma is treated by chemotherapy, radiotherapy. Retinoblastoma treatment depends on the stage and grouping. Orbital dermoid in toto excision because of cosmesis. And orbital cellulitis, you have to know. Orbital cellulitis question was also asked in one NEET exam. Remember that CT scan, radiology question, opthal question, subperiosteal abscess, preseptal versus postseptal is also very important. Staging is also important. Clinical question is also important on orbital cellulitis. Now, one optics, the amplitude of accommodation. Accommodation means you have to accommodate to see near objects. And lens is very important to accommodate in the eyes. Lens converging power increase. So lens is very pliable in a child. So child has very high accommodation. That's why the near point is very close to the child. He can read his book very close to the eyes. But what happens when we age? The lens become rigid. The accommodation decrease. Near point goes away, 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 away. That is the near point concept. You should have got this question correct. Presbyopia. ABCR, far point concept. Myopia treated by minus concave. Hyperopia by plus convex. Astigmatism can be plus minus cylindrical. Who can tell me the treatment of presbyopia is again plus convex. Near glasses. Near glasses are always convex. And which drug can assist accommodation? 1.25% pilocarpine can assist accommodation. Seal body contractions or noise relaxation is done by pilocarpine. That is also can be done for presbyopia, but near glasses is the main treatment of presbyopia, and that can be in the form of bifocals. Upper segment for far, lower for near. So near is always plus. Upper segment can be 0 for emmetropia, plus for myopia, minus for plus for hypermetropia, minus for myopia. Okay, so that should be presbyopia. Should be solvable question. Now this question I have given purposefully because one option you can rule out this question. What is this showing? It is showing a visual field charting. It is given to you already, and if you see carefully in the image, it is written. It is always patient's view. So it is written right. Means this is the right visual field. This is the left visual field. And what is it showing? This is showing this. I will mark over here. See this. This is on the same side. This is the defect actually. Even if you don't know this X and Y, which is the defect, which is the normal area, you could have solved this question. Because this is on the same side, na? This X is on the same side. This is homonymous hemianopia. This is not bitemporal. That is the answer of this question. This is not bitemporal. Yeah, you could have confused, sir. It is right homonymous or left homonymous. That I agree. You could have confused, but this is not bitemporal hemianopia. That is the answer. So this is what? What do you think? X is a defect or Y is a defect? Let me ask you this. X is a defect or Y is a defect? X is the area where the patient can see. This is the Goldman perimetry in which the stimulus is given. So doctor is charting which area patients can see. So this X is the area which the patient can see. Y is the area where the patient cannot see over here. So this is what? This is your left homonymous hemianopia. ना यही तो गलती है. देखो देखो सबने X लिख दिया, X लिख दिया. निवेदिता ने Y लिखा. अगर मैं पूछ लेता ये which is the defect, तो आंसर गलत हो जाता आपका. आंसर गलत हो जाता. This area, the Y area, patient cannot see. This is left homonymous. That is seen in right optic tract lesions. It is homonymous, right optic tract, and Wernicke is seen in optic tract lesions. हाँ, शब्ददीप सिंह तो हैरान हो गया. अरे ऐसा भी हो सकता है, ऐसा भी हो सकता है, ऐसा भी सवाल आ सकता है. ओके, दिस इज गोल्डमैन पेरीमेट्री. आज तक तो आपको एग्जाम में ऐसे सवाल आए थे ना, ऐसे तो सॉल्व कर सकते हो ना, इन विच दिस ब्लैक पोर्शन इज देयर, दिस वन right homonymous सवाल था last year's NEET में, that is right homonymous. Black portion means patient cannot see. कई बारी in the quiz I've given some buildings, half buildings is there and half white. और building है तो मतलब दिख रहा है ना patient को, तो building है मतलब दिख रहा है, opposite side will be not seen. And here the thing, this one is the charting given by the doctor, so that is seen. This is left homonymous heminopia, right optic tract lesion. But in fact, नहीं googly नहीं था ये AS, googly नहीं था. You could have solved this question from first option. Bitemporal तो किसी हाल से नहीं है ना, at least you could have solved that. Bitemporal तो नहीं हो सकता ना, bitemporal तो दिख ही नहीं रहा, चाहे आप x को y को you make it different. Bitemporal तो patient cannot see ना, so bitemporal तो किसी भी तरीके से नहीं दिख सकता. You would have answered the question from that only. चलो, yes. Now थोड़ा सा दिमाग लगाओ, दिमाग नहीं, थोड़ा सा presence of mind चाहिए. First A option is what? The ray of light is focused on the retina, emetropia. B, ray of light is focused in front, that is myopia at a single point. C, ray of light is focused behind, single point, hypermetropia. And D, ray of light is focused at multiple points, that is astigmatism. Itna to basics, this is basics of optics. The question is, which of these requires this lens? Now this lens is what? What is this lens? See, the image is magnified, like a magnifying glass, and magnifying glass at your home is what? Convex or concave? Magnifying is convex, and convex is treatment of what? Hypermetropia. That's the answer of this question. Alright, so that is the 15 questions. I could have given only 15 questions. Let me know how many questions you got correct. Quickly write. Then I'll quickly discuss the INI questions. The predictor one, INI questions we'll discuss. But that is actually I gave just to know whether you were seeing the INI predictor questions or not. How many? 14. Very good. नहीं 15 में से 20 है मुझे पता, वो तो कर रहा हूँ. 15 में से कितने सही हुए अभी तक? 12. अरे 17 मत बोलो भाई, 15 में से बोलो. ये तुम लोगों को समझ नहीं आता, मैं 15 में से पूछ रहा हूँ. 13. 15 में से पूछ रहा हूँ, 20 में से बाद में पूछूंगा. चलो ठीक है, 20 में से बताओ. दिस इज INA predictor question. Which corneal abnormality is seen? The full thickness cornea is there and iris is adherent. That is adherent glaucoma. I told you this in INA predictor also. This is adherent glaucoma. 16th question. Then same INA predictor question. -2 diopter spherical means -2 is working in both axes. Slender at 180 degree means it is working in the vertical axis, means vertical is -3, horizontal -2. Both are minus means both are in front of the retina, that is compound myopic astigmatism. And -3 is more in front, that is vertical is steeper, that is with the rule astigmatism. I'm quickly going through this because this was told in INI predictor. 65-year-old male present with diminution of vision in the right eye, redness, pain, IOP was 50. Right eye, shallow entry chamber. So shallow entry chamber rules out facultative glaucoma. 65-year-old rules out Fuchs. Shallow AC, just I explained, intumescent cataract, shallow AC pushes, that is phacomorphic glaucoma, intumescent cataract is the answer. There is nothing dandruff material written, so to pseudo exfoliative is not the answer. So C is the answer of this question. This is a visual field effect. Last year NEET exam question. Right visual field, blind spot is there. That's what is right. Then there is enlargement of blind spot. So enlargement of blind spot, so many times, 3 differentials I have given to already. It is seen in high myopes because of peripapilla atrophy. Optic disc is large in size. Peripapilla, papilla means optic disc, myelinated nerve fibers. Because myelination of the optic nerve stops at lamina cribrosa. Papilledema, optic disc, optic neuritis, optic disc margins blurred are having enlargement of blind spot. अब कितनी बार बोला glaucoma does not have enlargement of blind spot. Glaucoma is bearing of blind spot. Bearing का मतलब होता है English, not involving the blind spot. That cannot be seen. So glaucoma is not a cause of enlarged blind spot. And then on shining a torchlight in the right eye, there was constriction in both eyes. means for example there are two eyes like this, you shine the light in this right eye, both are constricting, means right optic nerve is okay, right third nerve is okay, and left third nerve is also okay, then only you can see constriction in both. But when you throw the light in the left eye, neither constricts. The only thing left is left second nerve. If left second nerve is transaction means totally cut. You throw the light in this eye, afferent is lost, so neither pupil will constrict. So answer has to be left optic tract lesions. Sorry, left optic nerve transaction. Optic nerve is cut, totally cut, not partially, totally cut. That is the 20 questions. Now you tell me how many questions you have got correct in totality out of 20. 5 questions you should have got from INI Predictor, otherwise you are not revising. Alright, 19, very good. Why not A? Because A will have sluggish reactions. In optic tract lesions, both people will constrict sluggishly. Alright, 17 above is a good number. 17 above is a good number. 16 is also okay. 16, 17 above is a good number. 20 out of 20. कौन है भाई? Nivedita Vemthul, very nice. So see, where are you getting mistakes? 2 options or 3 options? If 2 options you are able to rule out, it means you know the topic, just you're not able to recall at that point. But if you're not able to rule out 3 options, that means that topic is weak. Study that topic. Please explain 16th question. क्या है 16th question? Sixteen question ये तो nebula means less than 1/3 of the cornea is opacified. 1/3 to 2/3 is macula. Full thickness is glaucoma. But iris has also adhered. Now this is iris which is adhered. So this is adherent glaucoma. That can be a complication of cataract surgery. Glare and flare वाला concept तो अभी मैंने group में भी लिखा था. Glare is a symptom, flare is a sign. Flare is presence of proteins in the aqueous. In anterior uveitis it can be seen. And glare is intolerance to bright light. So glare can be seen in posterior subcapsular cataract, posterior capsular opacification. जैसे रात को गाड़ी आती है, पेशेंट को प्रॉब्लम होती है देखने में, वो ग्लेयर सिम्टम है. फ्लेयर तो साइन है. डॉक्टर को फ्लेयर दिखता है प्रोटीन्स इन द एक्वस, दैट इज अ साइन. या एन जो कह रहे हैं सर, वी कैन थिंक मैग्नीफाइंग लेंस प्लस इज मैग्नीफाइंग, सो प्लस मीन्स कॉन्वेक्स, कॉन्वेक्स इज यूज्ड फॉर हाइपरमेट्रोपिया. एस्टिग्मेटिज्म क्वेश्चन, सिलेंडर लेंस इज प्रिस्क्राइब्ड एट 90. कहाँ लिखा है एट 90 भाई? कहाँ लिखा है एट 90? सिलेंडर इज केप्ट एट 180 लिखा हुआ है. 90 कहाँ पढ़ लिया तुमने? At 180 means it is kept at horizontal. It will work in 90. So work in 90, that's why it is working in 90. Minus 3 will become in the 90. At 180 का मतलब it is kept at 180. It is working in. Lateral rectus question कौन सा वाला? 2 क्वेश्चन है lateral rectus में. Maddox rod वाला और वो ये second question और this one. ये लो. Lateral rectus palsy means eye is going inside because of Schrington law, esotropia. So esotropia has uncrossed diplopia. Second option was crossed diplopia. How to revise? Notes. If you can revise your own notes, then very good. Otherwise, short courses like LLR, very less time, DVT. DVT will tell you at least this much we know. And once a week grand test till exam, 3-4 grand tests you can do. In between, revise notes, multiple MCQ solving. So Ravi, multiple MCQ solving is your key answer. Spherical equivalent आएगा नहीं अब सवाल. SK spherical equivalent is take spherical power as it is, half the cylinder, numerically join. That's the formula. Take spherical as it is, half cylinder, numerically join. Difference between preceptor and orbital cellulitis. So 3 keywords: proptosis, ophthalmoplegia, decrease in the vision. Cannot be in preceptor cellulitis. इनमें से कोई भी कीवर्ड आ गया, इट हैज टू बी ऑर्बिटल सेलुलाइटिस. ये टाइम नहीं है पार्क 3 स्टेप टेस्ट का. शब्दीप ग्रुप में लिखो, या मैंने यूट्यूब में डाला हुआ है. यूट्यूब मेरे में पार्क 3 स्टेप टेस्ट है, यू कैन सी दैट. स्टार गार्ड्स एंड बेस्ट, डिफरेंस बिटवीन ना Stargardt is autosomal recessive, Best is autosomal dominant. Both have lipofuscin deposit in the RP layer, but Stargardt everywhere in the retina, Best in the center, like an egg yolk appearance. Vision is normal. Signs are more, symptoms are less. In Stargardt, patient says, I can't see. Doctor says, I also can't see. Because symptoms are more, signs are less. Electrooculogram is the investigation of choice for Best because it tells about the RPE. Stargardt is decrease in later stages. No treatment. Aishwarya, contact lens history था ना, contact lens history is there with papilla in the conjunctivitis, giant papillary conjunctivitis. If there is a young boy with itching in summers, then answer is vernal keratoconjunctivitis with cobblestone appearance of papilla. ट्विंकल ये सवाल है मूवमेंट ऑफ विच डायरेक्शन, वो तो टाइम लगेगा बताने में, मुझे मैसेज करो, इनबॉक्स करो टेलीग्राम पे या कहीं पे, ठीक है. Bilal Ahmed, Maddox rod question. Maddox rod question is always taken as patient's view. In my question, I have given Maddox rod in the right eye. So right eye will see a vertical line, left eye will see a torchlight. And patient's view means you are the patient. Means you have to assume that you are the patient, and the patient was having uncrossed diplopia because EZO has uncrossed diplopia. So B option is the line is on the right side, torch on the left side. That is uncrossed diplopia. All right, chalo, thank you very much. That was my time. Best wishes, and do well, and ask me questions anytime in the group or individual. All right, thank you very much.